The title of this session is Models of Novel Initiatives. My name is Sean Deneen. I'm a local endocrinologist based here in Galway and senior lecturer in medicine in NUI Galway. And my co-chair is Dr. Faisal Mohammed, whom you'll meet shortly. I have the enjoyable task of introducing Shadad, who is known to all of you, I suspect, and certainly known to all of us here in Galway. He is a force of nature, and I think is probably, along with his local organising committee, responsible for this meeting happening, and we're delighted to have you all here in Galway on a beautiful day. So Shadad is going to speak to us about Sudan Health Library, an innovative approach to support learning in health sciences.
This project has been developed by SMA UK and Ireland as part of our awareness of the importance of the educational resources, and we agree that it's essential to improve education, training, and healthcare practice. So we proposed this project around a year ago, and we're aiming to build a multidisciplinary library which is accessible to students and trainees from different healthcare disciplines in Sudan. We particularly targeting the medical students and the trainee doctors in early training, and as well as the nurses, nursing students and trainee, other allied health care professionals and researchers in health. So we are not only aiming for a library that provides resources, but we are aiming for the opportunity that could be created through creation of learning environment that connect students training in Sudan with their peers and learning facilitators and instructors from UK and Ireland in particular, or from anywhere in the world, who can give some kind of their experience to those students. And we know all about the concept of collaborative learning, so people learn from their peers much more than from their teachers and students and professors. I'm sorry to say this in front of professors, but that has been proven by research. So we're aiming also to create a platform for learning and continuous health education. Basically, this is just part or summary of the different sections of the library: medical library, which contain general medicine with its specialties; nursing and midwifery library; dental and pharmacy library; student library dedicated for the students' generic skills, how to do research, how to do search, how to do write, and all these skills. And then one of the important aspects we thought of to attract the students, the professional exams, the MRCP-I, MRCP, FRCS, all this type of exams. There is good number of resources available out there. We can make it available here, and as well as education and teaching and learning. So we are aiming that everyone who subscribed in the library, whether he is a student, trainee, or even training facilitator or learning facilitator, he would learn something new and something useful. And that could be provided through the discussion board, which involve everything about health and learning and teaching and medicine and nursing. Now, the important question is that was a question 6 months ago, but I'll go through the development of the project. How to fund this ambitious project, which is not easy. We realized that we are not able to do the whole project in one go, so we had to break it into 3 phases. Phase 1, which is completed at the moment, involved the library construction, and again we got opportunity to consult with our colleagues in Sudan during our conference last December, and the project was well received and welcomed. We also wanted to generate a sort of priority list for resources that we should provide through this library. And again, the administrative part of it, how to agree the access policy, user agreement, and all this type of things. And above all, and the important aspect is to provide a startup package of resources. After an extensive search of different models, we started with Blackboard, and then we tried Canvas, and we tried I can't remember the name, but it is developed by an Indian company. Eventually, we came to Moodle, which is, as you all know, is free, but the cost of developing it, security, IT support is there as well. Now, we said, okay, phase one. How to fund phase one even? That's another question. We had to think of a way to fund it and to keep everyone's contribution there, but you need a meaningful contribution. I'm sorry to say, but you don't want very small contribution which cannot be significantly highlighted in this project. So we thought of breaking this project into folders, shares, or unit, whatever you prefer to call it. And we said the unit for this project is called folder. And we went further to categorize these folders into memorial folders and academic folders. And I will explain the difference between them. Finally, we would like to honor and thank those people who really helped us in this project, or those who did remarkable achievement by highlighting their work. And we created a third category of folders, which is the honorary folders. I'll give you an example, and I start with this quiz. Please raise up your arm. This is for Sudanese, of course. Do you know those people? Or how many of you know them? Raise it down. Okay, 2, 3 out of 4. Okay. Now, those are leaders of health service in Sudan, developers of health service in Sudan. The person on the right is the founder of ophthalmology service in Sudan, and the person on the left is one of the founders of the obstetric and gynecology training in Sudan and the maternity hospital in Durman. The person on the right is Dr. Hussein Ahmed Hussein, and the person on the left is Dr. Abobakr Shadad, who was also president of the Medical Council in Sudan for, I think, 6 or 8 years. So by creating folders under their names, which bring their memory and their good work, and I think that is a good message to give to the newer generation, because as Professor Zain was highlighting earlier, you're not looking only for, you're looking for a role model, you're looking for a bright, shiny example to present for other people. I'll give another example. This is Professor El-Hadi Ahmed al-Sheikh, who passed in 2009. He's a president of Sudanese Ophthalmology Society. He framed the Arab board exams, regional exams in ophthalmology, established ophthalmology department at the University of Khartoum. Not only this, but he was a co-founder of the Sudanese Society for Care of the Elderly. That is part of his social engagement. That's part of his good work about it, away from his academic and clinical best practice. So those deserve to be highlighted and to be honored through this project.